Over 142 cancer patients at the Uganda Cancer Institute have been scheduled to start on treatment with the 3 newly installed radiology advanced TrueBeam linear machines. The Executive Director, Cancer Institute, Dr. Jackson Orem, noted that the TrueBeam linear accelerator is the latest advance in the radiotherapy technology developed to deliver cancer treatments with pinpoint accuracy and precision.
It is government of Uganda procuring. All this, we have put it together under what we call the PET project. In other words, our aim is to start with this equipment, but eventually we want to have the PET investigation. PET standing for positron emission tomography, which is now taking people outside of the country. So we want to have it also here. But you cannot have that when you don't have the basic things in place. And one of the basic things is the equipment like this one. So we are moving slowly towards making sure that eventually, maybe in the next 2 or 3 years, we have PET itself in the country.
TrueBeam opens the door to new possibilities for treatment of challenging cases such as cancers in the lungs, breast, abdomen, head and neck, as well as other cancers that are treatable with radiotherapy.
It's very important to get to know how fascinating this machine is. It has got about 4 or 5 capabilities in here. It is an X-ray machine, it is a CT scanner, it's a linear, treats cancer using X-rays and electrons. So it is 4 in 1. We treat the cancer according to the size and according to the shape and according to the location where the cancer is, which we used not to do 10 years ago. So we are really very delighted that we are treating the cancers very precisely, like what would be done in the US or in the UK or any other place in India or wherever.
With the new machines, over 90 to 100 patients will receive treatment on a daily basis, improving the overall patient's experience, as most treatments take few minutes a day.
With the additional 2 machines that we have received and started using, our backlog will not be there. So as you're called in, you come, report, start treatment. And the treatment is not a one-day treatment. We treat someone for a month and a half. Roughly 35 working days.
A 75-year-old and a retired civil servant, Vincent Ntege, was diagnosed with stage 3 prostate cancer in 2018 and has been on treatment.
I was already diabetic. So some of the symptoms, I thought they were symptoms of diabetes or something like that. But it was, there was also this prostate cancer, which had gone to almost stage 3. So when after they told me, they said, you come and see the doctor, you know there is a problem, then I knew there was a problem. Then afterwards they took the process, all that kind of thing. They said you have cancer. This is how it has spread, and we don't know. So there was an option either to go for surgery or to what, but then the surgery also said that we consult an oncologist. And the proposals were very, very expensive. They said you go to South Africa or go to India or go to Germany or what.
Ntege appreciates the government and Cancer Institute for the advanced cancer care he received and urged the public to normalize routine checkups. Zahara Abigaba, UBC News.